Clinicians are commonly faced with the removal of supragingival calculus in the anterior and posterior interproximal area. The traditional method of removal includes using the 34-35 jaquette for the posterior interproximal and the H6-H7 for the anterior interproximal. In the anterior setting, this is often difficult for both the patient and the clinician, as the instrument is positioned parallel to the long axis of the tooth. This can easily interfere with the clinician's line of visibility. Difficulties faced in traditional removal in the posterior setting include accessing narrow, difficult-to-reach areas. Oftentimes, the clinician finds it difficult to maintain proper ergonomics. The Montana Jack is a universal instrument designed by Paradise Dental Technologies in 2001. It is used by dental professionals to remove supragingival calculus in mainly the posterior and anterior interproximal portion of the dentition. This instrument is designed as a contra-angled scaler with universal adaptation. Due to the contra-angled feature of the Montana Jack, this instrument is ideal in accessing interproximal spaces while allowing for optimum visibility. With proper use, the thin Montana Jack allows the clinician to access hard-to-reach interproximal spaces for posterior and anterior teeth. It is beneficial for any clinician to learn how to properly utilize the Montana Jack in order to best access anterior and posterior interproximal surfaces while maintaining good visibility, proper ergonomics, and optimum patient comfort. To begin using the Montana Jack, grasp the instrument with a modified pen grasp by placing the instrument between the thumb and index finger on the lower 1/3 of the instrument handle. Rest the middle finger anterior to the index finger and hold on to the instrument with a light grasp. To determine the correct working end of the instrument, hold the scaler vertically and notice the curvature of the terminal shank. Compare the working ends by rotating the instrument 180 degrees. Select the working end with the terminal shank bent towards the mesial. Select the tooth to be scaled. Then, select a tooth within 1 to 3 teeth and on the same arch to place your intraoral fulcrum on either the occlusal, incisal, facial, or lingual surface of the tooth. Hold the instrument vertically, close to the working area of the tooth. Adjust the angulation of the lower shank. Then, align the lower shank parallel to the long axis of the tooth. Next, direct the tip of the instrument towards the distal of the tooth. Then, move the instrument and position it at the distal line angle of the tooth. Once the tip is correctly directed, position the lower 1/3 of the cutting edge against the tooth surface. Once the instrument is positioned, insert the blade no greater than 1 to 2 millimeters below the gingival margin. Keep the face of the blade closely adapted to the tooth surface. To begin instrumentation, begin by rotating your wrist on your fulcrum. Maintain control of the instrument and fulcrum and begin activating horizontal, vertical, or oblique strokes. Apply lateral pressure to the cutting edge of the instrument. Concentrate the pressure onto the lower 1/3 of the cutting edge. Begin to roll the instrument in your hand, keeping the cutting edge adapted to the surface of the tooth. Continue by advancing the scaler around the distal of the tooth and into the interproximal space. Continue by extending the stroke at least halfway into the interproximal space. Then, remove the instrument from the interproximal space and reposition the lower shank parallel to the long axis of the tooth at the distal line angle. Direct the tip towards the mesial portion of the tooth. Repeat the proper instrumentation moving towards the mesial interproximal portion of the tooth. The same instrumentation process can be applied to the anterior portion of the dentition, as the Montana jack is a universal instrument.